Hello there. Welcome to another episode of Rare Diseases, a podcast run by Rare Disease Review Western, a student-run not-for-profit organization that aims to translate complex rare disease research into easy-to-digest articles and that supports and advocates for rare disease patients and caregivers. Today, we welcome Hyejin Park, a researcher and account manager with Ipsos Canada, a branch of the global polling and survey company, Ipsos. And she is a graduate of the Master's of Science in Public Health program at McGill University. Hyejin will be speaking to us today about her work on surveying the experiences of rare disease patients and their caregivers in the Canadian healthcare system. Hyejin, it is a pleasure to have you on the podcast today.
Hello, nice to meet you. So I will introduce myself a little bit. As Omar mentioned, I am an account manager within the public affairs team at Ipsos Canada. I bring about 2 years of experience in both quantitative and qualitative research methods. My background blends a bit of pure sciences with methodological training and epidemiology, data analysis, and statistical methods. I hold a Master of Science in Public Health from McGill University, as well as a Bachelor of Science specializing in microbiology and immunology. Henceforth, health is a very big topic of interest for me. Currently, at my role at Ipsos, my responsibilities encompass a wide range of tasks, including executing quantitative research for public and private sector clients, managing projects throughout their life cycle, and analyzing and reporting on study findings. And so I'm really excited to be here today to talk about one of my research projects that I got the honor of doing for a client.
And we're very excited to have you on the podcast as well, Hyejin. Thank you so much for that little introduction about yourself. We actually were going to ask you about that, so that's awesome.
Yeah, so our next question for you, Hayden, is often we see that public health headlines on major topics like COVID-19 and cardiovascular disease are promoted, but not as we don't see as much on rare diseases. And so with that in mind, why do you think a public health focus on rare disease is so important?
So, like I highlighted in my public health background, I've studied extensively on public health, and a public health focus on rare disease is quite crucial because of the significant impact these diseases have on individuals and eventually the healthcare system as a whole. So, even though we think that these specific diseases may be rare and it only affects one or two people in our Canadian population, collectively, the people who live with rare diseases affect a substantial proportion of our population, and they all individually have complex and challenging medical journeys. And so when we learn about universal healthcare systems like we have in Canada, where healthcare is supported and funded through the government, we have a dilemma of making sure we curate and serve individual well-being, but we must balance it against the scarcity of resources and the need to prioritize population health budgeting as well. And so within this survey that we conducted, we've heard voices of patients and caregivers of people with rare diseases across Canada, and that they voice the concerns of the inconsistencies level of care across provinces, even within the same country of Canada, because that they have to face different challenges, especially faced by those living with rare diseases. And so increased awareness, research, and support are vital to improve diagnoses, treatment, and overall quality of life for those affected, highlighting the importance of addressing the significant challenges faced by this community. So in essence, even though with the term rare, we think it's only a couple people, collectively, as a whole, they are a huge part of our healthcare system. And those individual voices are important and need to be heard and considered for public health topics as well.
Yeah, thank you so much for taking the time to answer that question. I mean, yeah, from I guess an epidemiological standpoint, we can't really forget about rare disease patients when, we have a universal healthcare system, like you said, and everyone is integrated into the system and everyone has a voice and, their place in that healthcare system and in society matter a lot. So yeah, I appreciate you, I guess, highlighting those important points about the public health focus on rare disease.
I actually have like a small little tidbit with side tangents on that point because essentially it goes towards the feeling of orphan drugs as well. So like the lack of healthcare funding from or the need of government support for these people living with rare diseases due to pharmaceutical companies as well, not having no incentive for these big pharma companies to be focusing on rare disease research. And so it also highlights the importance of other government and other support in order to ensure that all these individuals are being well taken care of. There's a very interesting, I believe it's a video or a podcast done by the NHS in England because they often face the similar dilemma of with the very limited healthcare budget, are we focusing on flu treatments that help thousands of residents versus this one specialized genomic drug that can only help 5 people in their country. So this is a little side tangent, but it's a dilemma of public health. But that also never underscores the importance of it is because if it is a person with a rare disease, this is their life.
Yes, exactly. Thank you so much for, adding that extra point to that. So, over the past few years, you worked with CORD, or the Canadian Organization for Rare Disorders, to survey the experience of rare disease patients and their caregivers throughout their medical journey. And for our listeners, you can find the link to the report on that survey titled Experiences of Rare Disease Patients in the description of the podcast. Hyejin, can you tell us why this survey was conducted and what gaps in the understanding of rare disease care we needed to highlight?
Yeah, for sure. So we've had the pleasure to work with the Canadian Organization for Rare Disorders, or CORD, as I will be calling them from here on out. And on their latest study, we conducted a mixed method research, a quantitative portion conducted between October and November of 2022, followed by a small qualitative portion of individual interviews in January and February of 2023. And we focused on the experience of patients with rare diseases and their caregiver. And it was a crucial piece of evidence in informing Canada's newly developed rare disease strategy that was introduced in March 2023. So we were really rushing to get this through the door to make sure that the patients and their advocates basically were able to lend their voice and lend their opinions to direct policy making change. And so like I said before, the primary objective of the research was to gain the current perceptions and experiences of patients and advocates navigating and accessing healthcare for patient population, and also to empower these individuals and giving them a voice in shaping policies. Why this survey was conducted, those were our primary objectives and gaps in understanding the rare disease care we need to highlight. So the survey results highlighted several critical gaps in understanding and addressing rare disease care. These included the urgent need for a comprehensive approach, as advocated by CORD, emphasizing the establishment of centers of excellence, or as they call them, expertise. So these centers would play a pivotal role in ensuring timely diagnosis, access to specialists, coordinated care, and ongoing patient monitoring and data collection. They basically found the gap and they were trying to advocate for that it was not just about drugs. There needs to be a more comprehensive approach and solution for people living with rare diseases. This survey also underscored the importance of equitable access to treatments, which was a critical concern for many patients who often face significant delays or a complete inability to access therapies readily available as compared to other countries. The findings emphasize the need for a multifaceted strategy that addresses not only drug access, but also encompasses early diagnoses, community support, and patient engagement in policy decisions. The insights gleaned from this research have been instrumental in shaping Canada's approach to rare disease care, and it signaled a positive shift towards more patient-centric and comprehensive healthcare system.
Yeah, thank you so much for sharing those results with us, Adrian. I really appreciate how you were able to involve rare disease patients and caregivers when conducting these surveys because it's really important to kind of hear from the people that, you are advocating for when you are designing or hopefully eventually designing these strategies. So I really appreciate that you were able to get them involved in this as well. And so another question that we had for you was that according to your survey results, Rare disease patients and caregivers often feel that their primary care physicians are not as aware of rare diseases as they should be. And so, from that, we were wondering how much do you think is the responsibility of the healthcare professionals versus of our healthcare system? And is this something that fuels the need for patients to advocate for themselves?
Quite honestly, this question is a bit tough. I don't think really, especially coming as a researcher, not a healthcare specialist, it is not my position to assign quote unquote blame to the professionals or healthcare system. However, anecdotally, from the results of our survey revealed that some patients often experienced inconsistent care and felt the need to and compelled to self-advocate for themselves due to the lack of awareness and understanding of rare disease among primary care physicians. So while some healthcare professionals might benefit from prioritizing knowledge of rare diseases, it's crucial to also acknowledge the systemic challenges that they face. There is a vast number of rare diseases, and in their name, they are quite rare. And coupled with limited resources, time constraints, and insufficient specialized training opportunities, it makes it very difficult for physicians to effectively diagnose and manage these complex conditions. For example, we had one patient share their experience of receiving a very fortunate diagnosis from a visiting physician. And so for them, rather than the blame on the system, it was more for them. They were more happy and fortunate, and they understand the challenges posed by the rarity of their condition, but they were really grateful for being at the right place at the right time. And so it also underscores a second key theme that emerged from our study, and it's that the lack of information and knowledge gaps among healthcare professionals was quite prevalent. One participant, this is a quote, says doctors are not well versed in rare diseases, leading to missed or inaccurate diagnoses, even from their own physicians who may change their initial assessment based on limited information. So a lot of some of the people I have interviewed or from the results of the survey, they one of their biggest voice of concern was the challenge to get diagnosed. And they do recognize that it's the lack of awareness that often lead to detrimental effects on patients. However, it is really hard to just put the blame on specific individual. I feel like with this, we should be more focused on addressing some of these barriers, improving access to information and resources, perhaps more specialized training to both empower patients and healthcare professionals in navigating the complexity of rare diseases.
Yeah, that was a wonderful answer. It is such a complex issue and everyone has such different experiences with it. So it's really important to kind of see that overall it's just the awareness that needs to be increased about rare diseases, whether it's from that systemic level or, in certain areas. But addressing these gaps is crucial. And I guess education would be kind of the answer for that. And we just had a follow-up question to that then. Given the experience of rare disease patients in the Canadian healthcare system, a quote that we often hear is when you hear hoofbeats, think horses, not zebras. So basically, when you hear hoofbeats, so horses and zebras both have hoofbeats, but medical students are generally taught that when you are hearing hoofbeats, think of horses who actually represent more common diagnoses and more common diseases rather than zebras who are more of the rare diseases or conditions. So when you are kind of like diagnosing a patient rather than thinking of something rare, they're taught to think of, what's more common, which are horses. What do you think about this quote?
Yeah, so I actually have heard a couple. So through our interviews, we did hear that some of the people's experiences that during the time of diagnoses, they experienced quite exactly what you said in the quote, that some of their doctors had dismissed or had assumed it was something more common. They were testing for something more common because, as like you said, that they are basically taught to think that they are horses rather than to expect or to envision a zebra, perhaps. But for them, it really was a challenge. And I think, like, it's true. Like, when we do hear it in Canada, we wouldn't expect zebras, but that doesn't mean they never exist. And so I feel like it kind of underscores and demonstrates what our current situation is, or perhaps just how rare diseases are not taught as commonly yet. But maybe perhaps this is a learning or like a new route for us to consider because zebras also have hooves as well.
Yeah, thank you so much for your answer on that. I think that was well said. And I think that while perhaps right now the healthcare system and medical education isn't focusing nearly as much on or prioritizing as much like the zebras, yeah, I really appreciate you taking the time to say that it's perhaps not the best idea to place like blame on healthcare professionals, and rather we should be putting like more hope and faith in how we reform and restructure medical education and the healthcare system in general moving forward, because the medical field is always evolving. So yeah, I think this is a really like insightful answer to that set of questions. Moving on to the next question. When it comes to rare disease care, it often involves more than just clinical care, involving things like mental health, community support, and access to easy to understand information about a rare disease. What did the survey find about how holistic rare disease care in Canada is? And how can the healthcare system better support all aspects of the rare disease care process?
It kind of touched upon a point I brought up about a little bit earlier, but when we ask about Canada as a whole, it doesn't show the whole picture because health is actually a provincial jurisdiction. And so the experiences of people really did depend on what city, how urban, how suburban, and what province that they were living in. And so, because of that differences, our survey did reveal that there are significant gaps in holistic care for rare diseases in Canada. So, some patients and families had to navigate the complexities of their diagnoses and treatment alone, and they felt that they struggled to find adequate mental health support, reliable community resources, and accessible information about their specific conditions. And so all of this burden often led to feelings of isolation, anxiety, and uncertainty. So a huge additional burden on their mental health. And so to better support all aspects of rare disease processes, the healthcare system needs to move beyond just a clinical approach. So it includes integrating mental health services into rare disease care pathways, fostering stronger connections with patient support groups and community resources, and providing clear and easy to understand information about rare diseases, treatment options, and available support services. CORD is quite committed in implementing Canada's rare disease strategy. And one of the big focuses that they are pushing for is to establish centers of excellence, which essentially is a center that is created to generate and support research and patient care and to implement clinical practice guidelines. And so basically, this type of knowledge hub for people living with rare disease and their caregivers. So it provides education, support, and other services. So they are really already focusing on a way to help support these people, not just clinically, not just symptom based.
Yeah, that was a great answer because rare diseases obviously are more than just, the clinical aspect of the condition, but more so it also kind of revolves around, the support system that you have and whether people feel isolated and things that we can do to support them, as you said in your example. And so something we also noticed about the survey was that it asked people whether they wanted a national rare disease strategy that was focused on rare disease care centers or on a national list of drugs. And so we were wondering, why was the decision made to ask about these two models in specific? And could a Canadian rare disease strategy combine both models?
To answer your question, when we conducted the survey, we presented respondents with a choice between two distinct models, two different extremes. So either specialized centers or a national list of drugs. And it was a deliberate simplification to understand patient priorities. And it was not to present like this false dichotomy of it has to be one or the another, but it was rather used to gauge preferences between the two. And so an effective Canadian rare disease strategy in reality should strive to integrate the positive aspects of both models. And so when we asked that question in our survey, about 80% of patients and caregivers expressed preference for specialized centers. citing benefits such as comprehensive care, research opportunities, and equitable access. However, a truly impactful strategy will also combine this with the equitable access to treatments offered by a national drug list. And so we hope and we are looking towards right now the current rare disease strategy that they are integrating and using both approaches to ensure that patients receive both comprehensive multidisciplinary care and timely access to the necessary medications.
Yeah, thank you so much for clarifying that, Hyejin. Because I know when I read through the report on the survey, I saw that dichotomy and the fact that like that rare disease patients and their caregivers favored the centers of excellence approach so much, but in the reasons that they cited for that preference, it was about making things comprehensive and holistic and integrating so many different aspects of rare disease care. So I really appreciate the fact that you highlighted that it's going to take really the positive aspects of both and make sure that rare disease patients are getting the best of both worlds.
Yes, for sure. And also to note, like some of the nuanced differences between those who favored one extreme to the other. So those who favored a national list of drugs, they tended to be patients or advocates of diseases that already had an existing treatment or diagnosis or some sort of solution plan, but they were unable to access those treatments due to the cost or for it not being covered by insurance. So for them, their true benefit would be their drug being on a national list and being covered. However, on the other side of the rare disease centers, a lot of these voices tended to be some people with rare disease, there is no cure, there's no solution. And so for them, it's a more comprehensive need of managing symptoms and managing just creating better care plans. And so even with this dichotomy, we saw how diverse those living with rare disease are and how their needs greatly differ.
Yeah, exactly. And each patient will have, different needs and all of those opinions and like needs will be valid. So yeah, I appreciate you making that further point. So as we have discussed so far, this survey uncovers a lot of key information about the quality of rare disease care in Canada. So what role do surveys like this one have for encouraging healthcare reform for rare diseases? And can they push policymakers to better act on the needs of rare disease patients and their caregivers?
This survey plays quite a crucial role in advocating for improvements of quality of care for rare disease patients. And by amplifying and giving an avenue for the voices of patients and families, it emphasizes the critical need for healthcare reform in this area. It also empowered these individuals to advocate for themselves and provided valuable tools for self advocacy through organizations like CORD, and it provides robust evidence-based data that support decision-making processes and encourages policymakers to prioritize the needs of the rare disease community. The data has also been instrumental in advocating for increased research funding, improved treatment access, and the development of the comprehensive national rare disease strategy. So with that, we can already see how it is helping towards the goal towards equitable and high quality care for all Canadians affected by rare diseases. The survey findings have been shared with key stakeholders, including government officials, healthcare leaders, facilitating the translation of data into tangible policy changes and driving meaningful improvements in rare disease care. Also, the need for accessible specialized centers for all Canadians, regardless of their province of residence, is evident as current disparities force individuals in less populated provinces to travel long distances for treatment and diagnoses. And so, with the national strategy for rare diseases, it is essential and it is quite necessary for a geographically large country like Canada, and we need to ensure that all citizens have access to appropriate care and treatment. And so that by recognizing rare diseases are treatable and prioritizing the needs of the community, we can strive for a future where all Canadians have the opportunity to live healthier lives.
Yeah, thank you. That was a wonderful explanation of, the importance of these surveys because it gives patients with rare diseases an opportunity to kind of advocate for themselves. And it's amazing to hear that some of those survey results have already been shared with stakeholders and helping develop that national strategy for rare disease. So our last question, I guess, for you today would be, as a final word to our listeners, what is something inspiring from the survey or from your work with CORE that you believe will give us hope for the future of rare disease care?
Tough question. It's been almost 2 years since we conducted this research and almost 1 year since the findings were published. And honestly, one of the most inspiring discoveries from this work was the incredible resilience and strength within the rare disease community. I mentioned before that I do have a public health background. However, myself, I never really had exposure nor the chance to have direct communication and learn about the experiences of those in the rare disease community. And from what I learned is that despite facing significant challenges, these patients and families demonstrate remarkable determination in advocating for themselves, raising awareness, and pushing for better care and support. They have quite an unwavering spirit combined with the growing momentum for the national rare disease strategy, which includes increased investment in research and innovation. That kind of gives me hope for a brighter future, especially for these patients. A future where individuals with rare diseases are able to get timely diagnoses, have access to effective treatments, and feel supported throughout their healthcare journey. And so it was quite truly inspiring to witness the positive impact of community support and the power of collective action in driving change. And so I'm really inspired and hoping to help move the dialogue on rare diseases. And we can contribute to improving the lives of patients across Canada and the opportunity to give voice to their experiences and empower them to feel like active participants in their own care has been really, really rewarding.
Yeah, thank you so much for those words. It really is inspiring the work that you are doing and that other advocates of rare disease are doing to kind of push that dialogue and make sure that, we are raising awareness and that we're getting to a point where we are able to, give that equitable care to all patients, whether they have rare diseases, whether, they don't, but making sure that everyone is kind of heard and supported in that matter within healthcare. So there you have it, listeners. What a fantastic discussion we had today with Hyejin. And thank you so much again, Hyejin, for your time today and for all of your incredible insight. It was wonderful to have you.
Thank you for having me. Yes, it was lovely to get to know you. I'm really inspired to hear that there is patient group and already advocating at Western University. So that's really inspiring to learn. And yeah, I'm always happy to share my experiences. Thank you.
Of course. And for our listeners, stay tuned for our next episode by subscribing to the Rare Disease Podcast on our YouTube channel or following Rare Disease Podcast on Spotify. Check out the description of this episode for the link to the Rare Disease Review Medical Journal and our social media pages. This is Rare Disease Review Western and Hyejin signing off.